Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
My name is David Núñez. I am the Family Health Medical Director for the Orange County Healthcare Agency, and I'm a pediatrician, board certified. I did my undergrad at Stanford Medical School at UC San Diego, and residency in pediatrics at Stanford and at UC San Diego. And then following that, mid-career, I received my master's in public health from Harvard. So I've been here at HCA for 5 years, and prior to that, I was the chief of children's asthma programs for the state public health department here in California, and I did that for about 8 years. Before that, I was a primary care pediatrician for Kaiser Permanente in Northern California. Probably like most physicians, I went into medicine because I wanted to help people and because I had a strong love of science and higher education, which was instilled by my parents. I specifically went into pediatrics because of all the different specialties you can go into, I really felt the strongest affinity and connection to pediatrics, particularly primary care, where you really get the opportunity to connect with families and children and really help them to achieve a good life course all the way through. In family health, I am particularly inspired by just the breadth of programs that we oversee. When we think about life course perspective, it's really that mothers, infants, children across their whole life trajectory have opportunities to improve their health outcomes. And so much of what we do in family health is really about helping families to do just that. Everything from our women, infant, children nutrition programs that support healthy pregnancies and good normal growth and development in early childhood, to our lead prevention program, to our childhood immunization program, and many others that really are, again, about achieving reduced risk in health trajectory and improving health outcomes over the long haul. In family health, we really do function as a team, and each of us brings our skill set. I bring particular skills in the area of pediatric policy and practice, and also in public health practice. And so many of our other programs have excellent leadership that, again, is based upon their skills in terms of nutrition, in terms of immunizations, childhood disability prevention, many other skill sets that we all work together as a team to bring those skills to the community and to maximize our impacts. Probably the most surprising thing is that here in the agency, we don't have a large number of clinical settings. In family health, we have one pediatric clinic on 17th Street in Santa Ana. So we don't have a large clinical footprint, but we do have a very large footprint in terms of our collaborations and our connections to community organizations and other stakeholders who care about children's and maternal health. I think one of the things I'm most proud of is that since I've been at the agency, we've really developed a very robust Orange County Perinatal Health Council, which is, again, made up of a number of stakeholders that are really working together to help us to improve birth outcomes and infant outcomes across the county. And when I talk about birth outcomes, it's improving prenatal care, it's improving the number of women who breastfeed successfully for a full year, as is the recommendation. It's in reducing the number of sudden infant deaths that occur in the county as a result of unsafe sleep practices. And I could go on, but again, I think I'm really proud of the fact that we don't just do it alone, we really do it in partnership with so many of the other stakeholders in Orange County.